One of the things we do besides routine diagnostic x-ray, which we have digital x-ray in the office, is with non-surgical spinal decompression. The question is, patients will bring us in an MRI, and if you have an MRI, look at your reports. You'll see multiple levels that are deteriorated often in your report. Multiple levels of herniation. And so the question is every single disc creating the pain you have? In most offices that do non-surgical spinal decompression, they won't do what I'm about to show you. In my office, since I'm trained, I served an externship at Stony Brook University Medical School in EMG. What we'll do is we'll do a EMG, a needle EMG, in the office, which will define physiologically which nerve and or nerves are affecting you. Now, this is a nerve conduction study. It's not the needle portion of the study, but it's an example of the type of work we do in the office. So then what we can do is we'll take you down the hallway to a patient that's being treated now and show you how the equipment can specifically focus on an individual level that's bothering you, defined by this EMG. So it's not just enough, in my opinion, to say, okay, we have a table and it can do non-surgical spinal decompression. Specificity of treatment, to focus on the lesion site that you have, is what the medical profession should do if they're doing epidural steroid injections, right? They don't want to just give you a bunch of blocks everywhere because the MRI says to do so. In my opinion, they should be focusing on the lesion site, the one that's productive in your pain, and that's what we do here. By virtue of the fact that I'm trained this way, which is honestly very unique in my profession. Let me take you down to a room. Here's a patient that's being treated, and he's being treated at a very specific level here. This happens to be L5-S1. But the equipment itself can focus on angling this table to a specific level, L1, L2, L3, L4, L5, that might be producing the patient's condition. And if that EMG shows that there's multiple levels, let's say it was L3, L4, or L4, L5, S1, we'll go to the highest level and decompress both of those lesions. Because it can be multiple areas that are producing the problem, not only one. So by knowing that, it creates a specificity in treatment and a better prognosis and a better outcome, in my opinion, from my experience, than you would experience otherwise. So if you feel that that's a benefit to you in your search for someone to examine you for non-surgical spinal decompression, you can call 631-584-7722 for free consultation and MRI review. I'll be happy to see you.